I'm going to hand over to Kristine Sørensen now, who's going to now pick up on the theme of health literacy. So I'm delighted you were able to join us, Kristine. I just know how busy you are.
Thank you. My name is Kristine Sørensen. I'm the founder of the Global Health Literacy Academy. I'm also president of the International Health Literacy Association, and I'm really happy to be member also of the Center for Empowering Patients and Communities. And this is really close to my heart, because I believe health literacy is a key attribute to support healthy communities and cities. So urban health is one of the global trends impacting health of today. By 2050, 70% will be living in cities around the world. But urban health is also a double-edged sword, in the sense that on one hand, health will be improved in cities because people move to communities and cities to get jobs, and there is easy access to health services. On the other hand, we also know that cities are vulnerable. There is a higher level of violence, there is social inequities, and people are faced with food scarcity and poverty and so on. So these are these two forces that we are trying to manage when we talk about urban health. So moving then to health literacy, and it's linked to citizen empowerment, we have seen that the World Health Organization has really highlighted this connection in their Shanghai Declaration, which is on the next slide, where health literacy is on one of the three pillars. The three pillars of health promotion, according to the World Health Organization, show that it's good governance and health literacy and urban health. And health literacy, what is it really? We can define it as the knowledge, motivation, and competencies to access, understand, appraise, and apply information to make decisions in everyday life. So health literacy is a key attribute for urban settings because it's the fundamental factor for seeking information to manage health and interact with services related to health and well-being in everyday life, and it changes over the lifespan. I wanted to introduce you to a model. I know it looks a bit complex, but let me run through it a bit for you to fully understand the dynamics around health literacy. So it's about finding, understanding, and appraising and applying information to take decisions, as you can see in the center, really when you're ill and when you're at risk and when you try to stay healthy. So in terms of healthcare, disease prevention, and health promotion. But we also know that health literacy is impacted by personal determinants, so your age, your level of education, gender, and so forth, and where you live and work, so situational factors, and the broader societal factors. And then health literacy in turn has an impact on health service use and health costs eventually, the status of health status of people and their health behavior, and also how people engage in society. And there is a strong social gradient to health literacy, which impacts sustainability. And we can look at health literacy from an individual point of view or from a population level. And it's important because health literacy, if you're health literate, it helps to save time and cost and lives eventually, because health literacy helps to increase health status. If you know more how to manage your health and you are well informed, you also know how to protect yourself, you know how to keep physical distance and wearing masks and so forth to protect yourself against the coronavirus. We know it decreases hospitalization, so those who are health literate and know when to act in a timely and appropriate fashion, they also are helping themselves to manage illnesses before it's too late. And it increases preventive measures in the way that there is a higher uptake of vaccines and participation in cancer screening, for example, among those who have higher levels of health literacy. And it increases quality of care because when people are having the competencies to discuss their own treatment, and if they are well informed and take part in shared decision making, also eventually most outcomes are better than if they don't. And lastly, as I said, it increases active participation and patient engagement. So we see that people are showing higher levels of health literacy. They are very often also engaged in their communities and involved in policy making, and engaged in patient fora, for example. And they are much more aware of their rights and their duties and obligations. However, when this is said, we also have seen from our research here in Europe that unfortunately in many countries, more than 30%, so 1/3 of populations, or even up to 2/3 of population, are at risk of having limited health literacy. So this will really impact the way they find information, how they understand it, and how they apply it in their everyday life. And we thought, we have a good European system, we have good welfare societies, we have good healthcare systems, we have good educational systems, and yet we do see that there is a problem when it becomes very complex. And we know we live in a time of information, the information age, where we are forced to navigate in a jungle of information, loads of mis and disinformation, and basically in the middle of the pandemic also fighting an infodemic. And unfortunately, those here who are struggling, they are also often having another burden of being poor, having poor health, and then also poor health literacy. So this really weigh in with a very high impact on inequity in the way that the resources, in the way that the health literacy is distributed in the populations. So what I do hope we could do is that we can look at health literacy in two ways. What seems to be the obvious one was to look at people's skills. How can we improve people's basic health literacy skills, really to match this complexity that I was talking about? We can do it through schools. Perhaps in the future we can introduce a subject called health, like we have math and geography and physics and so on. Perhaps we should also have a subject, or meanwhile adding project work on health and including it into school curricula one way or another. We can train parents to teach their children. We can work through peers. We can work at the workplace, so increasing health at work to support quality of health initiatives at work. It develops over the lifetime, and also if you encounter certain life event like being ill from cancer, suddenly you would need to learn about cancer, or if something happened to your loved ones, you would need to study new diseases, new ways of doing things, other eating patterns, and so forth. So really increasing the skills of people is one way. However, we could also strengthen it the other way, and that is shown on the next slide. Here, our focus really on organizational aspects of health literacy. How can we redesign our systems to be much more responsive to low health literacy? How can we increase the skills of the systems to actually match the complexity of people? And that people would have to go to the GP for certain things, to an expert for instance, and it's up to the system to make this redesign. So you see both ways. On one hand, increasing skills to match the complexity of systems, but also increase the skills of the systems to increase the complexity of systems. One of our public health specialists, very well known in Europe, is Ilona Kickbush, and she says health literacy supports a new form of health citizenship in which citizens take personal responsibility for health and become involved as citizens in social and political processes that address the root causes of health inequalities, as well as inequalities in access to care. So she really puts it health literacy as a fundamental for health citizenship, and says that health literacy is about rights, it's about access to care, and it's about transparency and knowing what to do and when to do it with the full support of systems. And it's in particularly she highlights health literacy in the digital age, where we also talk about how to share data and who should have access to your personal data. So what I really want to move towards is also the work of healthy cities. There is the network of healthy cities of the World Health Organization, where health literacy has now also been integrated to their strategic plans. And some years ago, I worked with healthy city coordinators to discuss what constitutes a health literate city. And we did a concept mapping, and you can see it here on the illustrations. And basically, we could boil it down to 5 specific action areas where cities and communities could work with health literacy in a proactive manner. So they recommended that health for all should be one of the values that cities and communities work with, and that health literacy is integrated in policies and strategies and priorities. So really, health literacy is a political choice, according to their advice. And then they advocated for introducing health literate workforces and developing these new structures and products and services to enhance the way we accommodate limited health literacy from a system point of view. And lastly, improve health literacy of citizens. And there were a few examples from healthy cities that are already front runners, and it's Belfast and Galway in Ireland and Stoke-on-Trent in England. And Belfast, they had, for example, workshops where they, with their staff, to decide how could they implement health literacy as part of their interactions with the citizens and the residents in the communities. And they had a co-production procedure where they also invited the citizens to join this way of, to explain their needs. And in Stoke-on-Trent, they focused especially on men's health to see how could they improve the health of men and what could be advanced from a city, from the city authorities' point of view to support men's health. When you're sitting here listening to this presentation, what could you then, do to improve health where you are, in the community where you work, or in the city where you are? So one way is to do a need assessment and thinking about how well integrated is health as a value in your community and your city. How is health viewed by citizens, by decision makers, by authorities? And how is health and health literacy really reflected in city planning? And are the needs and the concerns of citizens being listened to when it comes to health? What is the capacity of the community workforce and the city staff working on health promotion and health literacy? And again, thinking it from an organizational point of view, what are the needs and how are they accommodated when citizens interact with the systems? It could be the health services, but also often social services impacts on the way people feel and the well-being of people. And eventually, what's the health literacy impression of the citizens in your city? Stoke-on-Trent turned out to be one of the cities with the lowest levels of health literacy in England, and that's why they took action. There might also be certain suburbs or certain areas or specific communities where you can see that there are issues in terms of health literacy, and it might be relevant to start there. What you can do is to initiate a review of the materials that you're using so that you are sure they are easy to find, easy to understand, and easy to apply for the citizens. And also to start health literacy trainings and raise awareness among staff. And you can, as I said, really improve the interaction between citizens and the authorities, and not doing things for people, but with people. And then it's important to look at health literacy from a political point of view. We do see that some countries have already developed health literacy plans and strategies, national action plans. This is Scotland, Portugal, for example, and Germany, Austria. And then, as being really radical, we can do as what Ilona Kikbush is telling us: view health as a human right and health literacy as part of citizenship. What all of this leads back to is really how do we improve the Sustainable Development Goals? How do we transform the current societies to really become well-being societies where people not only live but also flourish? And I know this will be the topic also for the following presentations, talking about mental health and loneliness. So when we talk about health here in terms of health literacy, it's not only physical health and mental health, it's also about your social health, spiritual health, sexual health, health in all its dimensions. But we do see that a lot of communication material is really being designed only for physical health or mental health reasons, and they are designed in a way that are really difficult for lay people to understand. So it's up to us working as public health specialists or in the health promotion field to really try to bridge people in a much more coordinated way and in a much more tailored way. Only then we can make that transformation that is needed. If you want to know more about health literacy, you can download the International Handbook of Health Literacy. If you Google International Handbook of Health Literacy and open source, you would be able to find it. There is also a chapter on health literacy as a key attribute for urban health in the book called Optimizing Health Literacy for Improved Clinical Practices, which I wrote a couple of years ago. So feel free to contact me if you have any more questions. We're also open now for any reflections you may have had now. So thank you. Over to you, Jim.